Stand up for a second. Put one hand on the side of your hip, right here, and lift your knee. Just lift it. Did you feel that? A pinch? A dull ache? Maybe a click? Now let me tell you something your doctor probably didn't. That pain is not arthritis. In my clinic, I have seen patient after patient told the same thing. It's arthritis. It's wear and tear. It's your age. And almost all of them got worse because arthritis was not the real problem. Today I'm going to show you what is actually causing your hip pain after 60, the clinical test I use to find it, and the 3-step protocol to fix it, without injections, without surgery, and without living on anti-inflammatories. I'm Dr. Daniel from Movement and Longevity. Stay with me until the end, because what you're about to hear might completely change how you understand your own body. Let me start with something uncomfortable. Arthritis is the most overdiagnosed condition in patients over 60. And I don't say that to criticize doctors. I say it because the system is designed to be fast. Your doctor has 7 minutes with you. They look at your X-ray. They see some wear on the joint, and the easiest answer is arthritis. But here's what that X-ray is not telling you. A landmark study published in the Journal of Bone and Joint Surgery found that over 60% of people over 60 have X-ray evidence of arthritic changes in their hip, but no pain. None. That means X-ray changes and pain are not the same thing. You can have a worn-looking hip on an X-ray and feel completely fine. And you can have severe hip pain with a perfectly clean X-ray. So if arthritis isn't causing your pain, what is? That's exactly what I asked myself when Maria walked into my clinic. Maria was 64 years old. She'd been dealing with right hip pain for 2 years. She saw 3 different doctors. All 3 looked at her X-ray. All 3 said the same thing: arthritis, degenerative changes, wear and tear. She was prescribed anti-inflammatories, told to avoid stairs, told to rest more. So for 2 years, she rested, and the pain got worse. When she came to me, she couldn't put on her sock on the right foot without sitting on the bed and struggling for a full minute. She'd stopped going for walks because every step felt like grinding metal on metal. And she told me, "Dr. Daniel, I think I'm just getting old." No, Maria, you're not just getting old. I did something those 3 doctors hadn't done. I didn't just look at her X-ray. I tested how her hip actually moved, a functional assessment, a clinical examination. And what I found surprised her. It didn't surprise me. When I pressed on a specific point, right here on the outer side of the hip, Maria almost jumped off the table. That's a classic sign of greater trochanteric pain syndrome, inflammation of the bursa, a small fluid sac that cushions the outside of your hip joint. This is not arthritis. And when I tested her hip strength, specifically the gluteus medius, the muscle on the outside of your hip that stabilizes your pelvis every single time you take a step, it was almost completely switched off. Here's what happens. When you sit for extended periods, and after 60, most of us sit 8 to 10 hours a day, your hip flexors get tight. And when the front of your hip gets tight, the back and the side stop working. Your gluteus medius essentially goes to sleep. And when that muscle isn't doing its job, every step shifts extra load directly onto the joint. That's where the grinding comes from. That's where the bursitis comes from. That's what your X-ray is picking up, not primary arthritis, but secondary joint stress from a muscle that stopped working. The fix is not anti-inflammatories. The fix is waking that muscle back up. I want to show you the science, because this is not just my opinion. A 2019 systematic review in the British Journal of Sports Medicine looked at patients diagnosed with hip osteoarthritis and found that targeted hip strengthening exercises reduced pain by 40%, comparable to anti-inflammatory medication, but without the side effects. And a study from the University of Melbourne found that 72% of patients told they needed hip surgery showed significant improvement after just 12 weeks of targeted hip strengthening. They avoided surgery entirely. Your hip doesn't need to be managed with pills. It needs to be retrained. Here is the exact 3-step protocol I gave Maria. 10 minutes a day, no gym, no equipment. Exercise 1. The hip hinge. Stand behind a chair. Hold the back for balance. Hinge forward at the hip, not the waist, and let one leg float back behind you. Hold for 3 seconds. Slowly return. The key. As you hinge, you should feel a contraction in the glute of your standing leg. If you don't feel it, you're bending at the waist. Keep a long, flat back. Do 10 repetitions each side, twice a day. This reactivates the gluteal chain that has been dormant from sitting. Exercise 2. The clamshell. Lie on your side. Knees bent, feet together. Lift your top knee as high as you can, like a clamshell opening, without letting your hips roll back. Hold 2 seconds. Lower slowly. You will feel this on the outside of your hip and outer glute. That burning sensation is the gluteus medius waking up, the exact muscle that was switched off in Maria. Do 15 repetitions each side, twice a day. Exercise 3. The standing hip circle. Hold the back of a chair. Lift one knee and draw a slow, large circle. Forward, out to the side, back, and down. Do 10 circles forward and 10 circles backward on each leg. This lubricates your hip joint with synovial fluid, the natural oil of the joint. It's the difference between a rusty hinge and a smooth one. Do this every morning before you take your first steps of the day. 6 weeks after Maria started this protocol, she walked into my clinic without limping. She put on her own socks standing up. She went back to her morning walks. Her pain, down from an 8 out of 10 to a 2. Same hip, same x-ray, no surgery, no injections. The only thing that changed was that we gave the right muscle the right stimulus. If you have hip pain and you've been told it's arthritis, I want you to try these 3 exercises for 2 weeks. Just 2 weeks. And come back and tell me what changed. Comment hip below, so I know you're starting today. I read every single comment. And if you want the full movement protocol, the one I use in my clinic for hip, knee, and balance problems, subscribe to the channel. I release a new clinical protocol every single day. I'm Dr. Daniel. Remember, aging is inevitable. But losing mobility is optional. Take care of yourself. I'll see you tomorrow.